thank you for being here so promptly. We will start promptly. My name is Penny Wright. We're very fortunate to have a speaker here who I believe to be the finest speaker on this subject that you will hear. Her name is Andrea Rodriguez. She is a Long Island native who is licensed as an insurance salesperson. She represents 7 insurance companies, so she knows the gamut. She's been doing Medicare education for 14 years, has spoken frequently at libraries and many other venues. So we'll go ahead and get started. Please welcome Andrea Rodriguez. Stand by the microphone so everybody can hear me. Hello everybody, Andrea Rodriguez. Thank you very much to the Rogers Memorial Library and to Penny for inviting me here to speak on Medicare. The goal for my presentation today is to educate you on the basics of Medicare, the A, B, C, and D of Medicare. And in order to stay compliant, this is an educational presentation. So I'm not going to go into plan specifics. Sorry, I just saw my finger there. I'm not going to go into plan specifics. As she said, I'm an agent for different companies in Suffolk County, quite a few. So if you have a plan-specific question, at the end of the presentation, ask me for my card and we could speak about it privately. But today, my goal is to educate you on the A, B, C, and D of Medicare. And I'll just keep going and going. So I'll stop at certain points to take questions. The basic thing is, if everybody turns to page 3, I refer to this page a lot, and you'll see why, because I kind of think this sums up a lot of it. So,
anybody need a booklet? I think some might.
Oh, okay, yeah, I have a booklet at the front door, I'm sorry.
Just raise your hand if you don't have it. Anyone else on this side?
I was just waving.
Oh, you're just saying hi. Okay. Hi. Anyone else?
Okay, so the presentation is Medicare Made Clear, and it's understanding your Medicare options. My top Medicare questions that I'll be going over is who's eligible for Medicare? What are my coverage options? When can I enroll? What are my next steps? Once I'm covered by Medicare, how can I save money? And where do I find more information for resources? So I always start with who's eligible, because a lot of people come and they don't have Medicare Part A and Part B yet, and they're not sure when they enroll or how they get involved in it. Original Medicare is Part A and Part B, and when you're 65 years old, you are part of Medicare. You need to be a U.S. citizen and a resident at least 5 consecutive years. And then there's special situations. There are people under the age of 65 that have Medicare also. This is what a Medicare card looks like. It's a red, white, and blue card. That's a sample of it. And it shows that you have Part A with the effective date and Part B and the effective date. Today my presentation is about the A, B, C, D, and Medicare supplement plans. I'd like to go over all of that. And I start with original Medicare. So on the chart of page 3, you'll see at the top box it's original Medicare. When you turn 65 and you get your Medicare card, and this is for people that do not have employer coverage. Because a lot of people go, well, I turned 65 and I got my Medicare card, but it only says Part A. That's because you have employer coverage. The presentation is more geared to people who do not have employer coverage. They get their Medicare card, Part A and Part B, and now they need to make a decision. Do I want to go into an Advantage plan, or do I want to go into a supplement plan? So option 1 is your supplement plan, and option 2 is your Advantage plan. But I like to start right at the top of what is original Medicare. Medicare original is A and B. So Part A is your hospital insurance. It's inpatient hospital care. inpatient mental health care, skilled nursing service, hospice, and some blood transfusions. So your Part A is all your hospitalization. Some facts about the hospitalization. Most people don't pay to get Part A. You're entitled to it. It comes out of your monthly paychecks, and then when you turn 65, you'll get your Medicare card that says you have Part A.
Does it come automatically to Medicare card?
Yes.
A, B?
Not B, A.
A.
Yes. B, you elect to go into B, and I'll get into that. You pay only your deductible for a hospital stay of fewer than 60 days. So when you have original Medicare and you don't pick an option yet, there is a deductible that you have to meet for hospitalization. Enrollment, you cannot be turned down because of medical history. Everyone is going to be enrolled in Part A, even if you're already pre-diagnosed with something. Any preconditions are covered under Part A. The coverage, if you stay then more than 60 days in the hospital, instead of a deductible, you then have these co-payments with original Medicare that you have to pay. And multiple stays mean multiple deductibles. So for 2015, if you go into the hospital and you only have original Medicare, you pay $1,260. That's your deductible to enter the hospital. You could stay in the hospital from day 1 to day 60, and your fee is $1,260, whether it's 1 day or 60 days. If you come home and you're home for 2 months and then you go back into the hospital, you're responsible for your Part A deductible again. So that deductible is reoccurring with original Medicare only. When you go to a qualified, you can go to any qualified hospital that takes Medicare in the United States. So when you have original Medicare, you can go to any doctor in any hospital that's affiliated with Medicare in the United States. You'll never get a book that says these are the doctors in the network, these are the hospitals in the network. That's your golden ticket to go to any doctor in any hospital in the United States, your Medicare card. Hospital care outside of the United States is not covered. So that is your Part A, it's hospitalization. Your other part of your original Medicare is Part B. Part B is all of your physician services, whether it's in the hospital, whether it's your primary care doctor, a specialist, all of that falls under Part B. Outpatient hospital services, cataract surgery, anything that's not an overnight stay in the hospital is considered part of Part B. Your ambulance, outpatient mental health, all of your lab work, durable medical equipment such as oxygen, a hospital bed, is all under Part B. Outpatient physical, occupational, and speech language therapy, and some preventative care is in Part B. So, some facts about Part B. You are entitled to Part B, but you pay for it. So you turn 65. If you have employer coverage, most of the times your employer pays for your Part B, and you could opt not to take Part B because you have employer coverage. If you have no employer coverage, you want Part B, but there's a fee for it. This year, the standard fee is $104.90. That will either be billed to you or taken out of your Social Security check. That's no matter what side you pick, whether you go with option 1 or option 2, you always have to pay for your Part B to be part of Medicare. There is a fee for it. If your income is low, you could fill out a Medicare savings application, and they will put the Part B back into your Social Security check. So there's no maximum out of pocket. So there's no ceiling on original Medicare of what your expense will be. For coinsurance, you would pay 20% of the Medicare approved cost. So you go to the doctor, you have original Medicare, Medicare gets the bill, and they adjust it first. Let's say they get a bill for $500, they adjust it and say that office visit was worth $100. Medicare bills pays the doctor 80%, which is the $80, and about a month after you see that doctor, you're responsible for the 20%. So Part B has a monthly premium that's determined by your income, and this year it starts at $104.90. You may have higher premiums if you join after your initial enrollment period. So some people don't have employer coverage, and they go, no, I don't go to the doctor, they don't sign into Part B, and there are penalties. So if you do not have employer coverage, you need to sign up for Part B. Enrollment. You can't be turned down because of your medical history or your pre-existing conditions. Everyone's entitled to Part B. And coverage, you can get care throughout the United States, but generally not outside the country. And participating physicians who accept Medicare patients, you can go to any doctor that's affiliated with Medicare in the United States with your Medicare card. And some preventative health is provided. So what's not covered with original Medicare? We're not even going into what plan you picked yet. I'm saying if you just had your original Medicare card in your pocket, what's not covered? Your A and B deductibles, your co-insurances, which would be the 20% of your doctor bill. Your deductible for your hospital stay would be $1,260. Those fees associated with Medicare are not covered. Medicare Part B excess charge, which in New York is 5%. The doctor can say when you meet them, yes, I am affiliated with Medicare, but I charge a Medicare excess charge. And in New York, it's 5%. And it's 5% not of the $500 that they bill Medicare, but Medicare adjusts the bill to $100, so they could charge you 5% of the $100. So it's such a small amount, it's $5 on every $100. It causes more animosity about you signing that the doctor's not going to take what Medicare gives them, and more paperwork. The number is so small, I have never seen or had any of my clients get an excess doctor charge, but it's part of Medicare. It can happen. And it's 5% in New York. In other states, it's 15%. Also not covered is your hearing and dental. It's not part of, prescription drugs. That's a huge thing. So you have original Medicare, but it doesn't have a drug plan included in it. You have to elect a drug plan, which I will go into in my presentation. And hearing and dental is not covered under Part A or Part B. So that brings us to, now you understand you have original Medicare, you have no employer coverage, you get mailed a card, and you need to make a choice. And you have two choices. Your first choice is a supplement plan, and your second choice is Medicare Part C. I'm going to start with what is Medicare Part C. It's also called your Advantage Plan, and most of you know them as HMOs and PPOs. So it's a Medicare Advantage Plan, and what they do is they combine the A and the B, the doctors and the hospitals, and in many cases they put in a prescription drug. So it's like a package, it's everything on one card. You can go to the doctor with that card, you can go to the hospital with that card, and you can go to the drugstore with the same card. That's the advantage of it, one card. It's offered by private insurance companies. So when you elect to go onto an Advantage plan, you're electing to go into privatized insurance. And Medicare is no longer your primary in paying your bill. You went with a privatized insurance, and they will pay, they're in charge of paying your doctor bills, whatever company you pick, that's your HMO or your PPO. It often includes, because they call them Advantage plans, it often includes benefits that like routine vision care. Sometimes they have hearing aids built into it, gym memberships. They add these different things to make the plan even more to your advantage. To be eligible for Part C, you must be enrolled in Part A and Part B. So you have to pay your Part B monthly premium of the $104.90. You have to live in the plan's service area, and eligibility is not affected by health or financial status. Everyone's eligible to be in an Advantage plan. but you can have end-stage renal disease. If you do, you need to have original Medicare and a supplement plan. Some fast facts about Advantage plans. Again, I said that they're HMOs and PPOs. The plan premiums and terms, they change every year. So every year, when you have an HMO and a PPO, the whole thing changes. Your premiums can change, your co-payments to your doctors change, your hospital co-payments, your specialists. So every year, even if you go, I absolutely love the HMO I picked, you have to educate yourself because the next year it changes. And right now we're in the open enrollment period, which is October 15th to December 7th, which allows you to say, I really want to look at my Advantage plan, and I'm either going to stay in it for another year, or I want to go back into original Medicare and go to option 1. And you opt out of privatize and go back into original Medicare. This is the time of year. You have from October 15th to December 7th to make that change. Coverage, it's the convenience. People love the Advantage plan because it's the convenience of one card, one plan. Many plans include prescription drug coverage, and the coverage is often limited to service areas. So you have an HMO, and I'm going to go into what an HMO is and what a PPO. If you have an HMO, it's a health maintenance organization. When you sign a contract with an HMO during the open enrollment period that we're in now, it starts January 1st, and you'll get a book in an HMO of all the doctors and the hospitals that you could go to. If their name is not in the book, you then cannot go to that doctor. So you sign a 12-month contract with an HMO that, yes, I checked, all my doctors are in it and my hospitals are in it, and you sign a 12-month contract, but the doctors and the hospitals don't. So in March, you could walk into that doctor's office that you were like, I checked it, he's in the plan, and there could be a big sign, we no longer take Advantage Plan XYZ. At that point, you have to refer to your book and find a new doctor. So doctors and hospitals can leave the plan. We had a problem with Southampton Hospital, not this year, but last year. They left one of the big plans, and then they went back in it right in the middle of the year. So you have to be careful when you're picking an HMO. There's also a PPO, which is a preferred provider organization. So you'll get the book of doctors, and if your doctor's not in it, you could still go to see that doctor when you're in a PPO because it's the doctor you prefer. Instead of paying a lower co-payment if they're in the book, you could see that doctor, but you'll pay a higher co-payment to see the doctor when you have a PPO. But the advantage is you can, even if your doctor left the plan with the PPO, you could continue to see that doctor, but at a higher co-payment when you see the doctor. So coverage is often limited to service areas unless it's an emergency. And you may be required to see doctors and hospitals that are included in the plan's network. With an HMO, it has to be a hospital in the network. With a PPO, you can go to any hospital, but you'll pay a higher cost if it's not in the network. And may offer additional benefits not covered by Medicare. So these Advantage plans, as I said, they offer money towards eyeglasses or money towards hearing aids, or some of them have dental plans built into it. But that's what your Medicare Part C is. It's your HMO and your PPO, also Advantage plans. So, as I said, the HMO is a health maintenance organization. You have to stay in the network. And the PPO is preferred provider organization, and you can go to doctors that you prefer. There's also special need plans and HMOs and POSs, but the two main ones are your HMO and your PPO. Prescription drug plans are Part D. And Part D helps with the cost of prescription drugs and is offered through private insurance companies, and you must continue to pay your Part B premium to have a drug plan. So the cost, prescription drug coverage varies from plan to plan. In your area, there are 35 different prescription drug plans, and that's if you're looking for a drug plan outside of your Advantage plan. When you have an Advantage plan, the drug plan's built into it. But if you're with original Medicare and a supplement plan, you need to decide between those 35 plans what drug plan would be best for you. Catastrophic coverage protects you from very high drug costs, and benefits change each year. So your drug benefits, I meet clients who go, I loved it, I had the best plan, I want to stay in this plan. You need to do your homework, because even if your drug plan was perfect for 2015, it might not be covering your drugs for 2016. You want to check that they're covering your drugs, that there's not a deductible, and what your monthly premium is going to be for that drug plan. You need to, so coverage, each plan has a list of drugs that it covers, and you want to make sure that your drugs are covered before you enroll in a plan. And the list of drugs even change every year. Every drug has a different formulary, every drug company. And this is really important. Enrollment in a drug plan is not automatic. So if you did not enroll in a drug plan, there will be a penalty. And the penalty is 1% per month that you waited to join. So I meet a client and they say, oh, I've been on original Medicare for 2 years. Did you join a drug plan? No, I'm on no prescription drugs. Well, the penalty, because when you were on original Medicare, that you did not join that drug plan 2 years ago, is 1% per month. So her penalty is 24%. So she will always, for the rest of her life, pay 24% more than what her neighbor pays for the same exact coverage. So the penalty is not this one-time fee. It's a big fee, and the fee, that penalty stays with you. So if you're not sure about drug coverage, if you, if you're not sure if you should have enrolled, if you did enroll, contact me and I can help you. People who do not get the penalty are veterans, because you do not have to join a drug plan if you're a veteran. So there's some circumstances that I could help you if you got stuck with that penalty, that maybe you wouldn't be responsible for it. So what is Part D? They divide the drugs into formularies. And when you're looking at a drug plan, the drug plan will say what tier your drug falls into. So there could be two people, two neighbors on the same drug, but have two different drug plans, and one will be, the drug plan will code it as a tier 1, and it will be very affordable, and the other company might code it as a tier 2. So you want to see where your drugs are coded and tiered before you join the plan, to know what it's going to cost when you go to the pharmacy to pick up that drug. So it's not only important to know, are the drugs covered, but what tier do they fall into? And the Medicare website's a wonderful, wonderful tool, medicare.gov, and you put in that you're looking at prescription drug plans, and you put in all of your drugs, and then it will tell you what drug plans, it will rate them as to what drug plan carries all your drugs for 2016, and what the prices will be, and for your monthly premium, and even right down to the penny of what your price will be when you go pick up the drug at the drugstore. And that's another thing I assist my clients with, is helping them figure out what drug plan would be best for them for the following year. I want to explain to you the donut hole, because that's a big thing everybody hears about, and they're like, I really don't understand it, and what the numbers. So the easiest way I could explain it to you is there's 3 stages. You have your initial coverage, then you have your donut hole, the gap, and then you have catastrophic. So you walk into the pharmacy, and when you're in the initial coverage, you're picking up a $100 drug, let's say. When you're in your first stage, you'll go to pick up that $100 drug, and you're responsible for 25% of the cost. So you will pay them $25. But Medicare and the drug company is keeping track of the full $100. So the plan paid $75, you paid $25, and they're going to calculate the full $100. When your expenses for the drug, what you paid and the plan paid, go up to $2,960, you then fall into the donut hole. Now you go to pick up that same drug you paid $25 for 6 months, and when you're in the donut hole, if it's a generic drug, you'll pay $58 for it, and if it's a name brand drug, you'll pay $47 for it. When you pay the 47% for the name brand drug, they're only going to keep track of the $47 that you spend, not the full $100 anymore. When you alone are out of your pocket $4,700, you then go into catastrophic coverage. You go back to that same pharmacy to pick up your $100 drug, and when you're in catastrophic, meaning you have been out of your pocket $4,700, the pharmacist will say that drug is $5. It then goes down to 5%. So no matter what drug plan you pick, whether it's with original Medicare and you pick a drug plan, or it's built into your Advantage plan, that's the stages that all of them, that's the guideline for all the drug plans. Everybody understand that? It's you know, a little comprehensive, yeah.
So it's personal plus the two together, but when you get into the coverage gap, it's just the personal.
Yeah, it's just you paying 5%,
They
and
don't take
nobody's keeping track of anything anymore. You can stay into the coverage gap until December 31st, and then January 1st it starts all over.
Thank you.
You're welcome.
So the highest you would pay is $4,700?
Correct. And at that point, when you out of pocket are at $4,700, you're in catastrophic. Now, there are wonderful resources. There's a plan called EPIC. It was started by George Pataki, and it's still up and running, and it goes by your income. So if your income is, and you file single, is $50,000 or below, they raised it to $75,000. If your income single is $75,000 or below, you could be part of EPIC, and if your income joint is under $100,000, you could be part of EPIC. And EPIC, I always encourage everyone to look into it, especially if you're falling into that donut hole. If you're just on generic drugs, a lot of times, you know, it's not a big expense, but when you're paying, and plenty of clients of mine are, thousands of dollars for drugs, EPIC kicks in and assists you with your donut hole. So when you go into the donut hole, the most you'll spend for your drug is $20. EPIC goes by, as I said, your income. If your income is below $23,000, EPIC will pay for your Part D coverage. They'll pay each month for your monthly premium, yes. You have to be 65 to look at EPIC. So if you have Medicare through a disability, you cannot be part of EPIC. Yes.
If you never join and you're qualified for EPIC and get EPIC, do you still have to pay the penalty?
No, if you're a veteran or if you have very low income and you get into the Medicare Savings Program and EPIC, the penalty won't apply to you for certain income situations. Yes.
If you're in the hospital, I didn't see medications.
Medications in the hospital, if you're in an Advantage plan, will fall under the Part D. And if you're in the hospital, sometimes they fall under Part B. It depends on if it's an injection or if it's a tablet, and it would also run these guidelines of the different stages.
So it could be covered under B.
Yes, there are quite a few.
Or it could be covered under your G.
Yes. Drugs in the hospital would fall under B or D, correct, yes.
Is EPIC another Part D plan?
No, you have to join a Part D plan to have EPIC. It's in addition. So once you have a Part D plan, if your income is low, EPIC will assist you with it, but you cannot join EPIC without first having a drug plan. On either side, whether you chose option 1 or option 2, EPIC will assist you. There's another question, yes.
When you use the word veteran, Is that a retired veteran, one who's observed?
Anybody who's registered at the VA office and has a veteran's card. So if you are a registered veteran at your VA, you could get prescription drugs right from the VA and they'll mail them to you, and you do not need to join a prescription drug plan. Now, it used to be that everyone would roll their eyes and be like, I did it, I went there, it was a nightmare, but they've really come a long way. You have to go once a year, and then the VA will mail you your drugs as long as you show up once a year and they confirm the prescription drugs that you're on. You do need to see a doctor at the VA once a year to have your drugs mailed to you. Yes?
What about if you're a family member of a veteran?
No, you have to be. There's no benefits for a spouse, for anyone. Okay, so now we're going to go into option one. What is a Medicare supplement plan? So the first thing you'll notice on option one, underneath the word option one, is keep original Medicare and add a supplement. To me, that's worth so much, because when you keep original Medicare, it allows you to go to any doctor and any hospital in the United States. And you could choose your doctors, you could choose your specialists. You'll never get mailed a book as to who's in the network, who's not in the network. Your Medicare supplement insurance plan will help you cover what the Medicare Part A and your Part B, what they don't cover. Such as your co-insurances, your co-payments, your deductibles. It's also offered by private insurance company, and you know you're looking at supplement plans because they're lettered. It's not called an HMO or a PPO. The main difference is they call it alphabet soup. And this is where it gets confusing, because there is a Plan A, and it's different from Part A. I don't know why they named them the same thing. There's a Plan B, and that's different from Part B. And the higher plans, Plan F and Plan N, have a lot of coverage, where with let's say Plan F, you pay your monthly premium, and then that's all you pay when you have a Plan F. Everything's covered by the supplement plan. So when you see a doctor or you go to the hospital, there's no co-insurance, there's no co-payment, everything's covered 100%. A big plan this year is F+, which is having that benefit of everything covered 100%, but with a deductible, and the deductible would be $2,180. If you hit that deductible, then you have Plan F and everything's covered 100%. The benefits vary by plan. Generally, the more comprehensive the coverage, the higher the premium. But this is the interesting thing about supplement plans. I could have two neighbors that both have Plan F, and one is paying double than what the other one is paying. But they have exactly the same benefits. So the government says you have to follow these guidelines. Plan F is Plan F no matter who you get it from. But they let every company put their own price on it. So when you're shopping for a supplement plan, after you do all of your research, it's in your best interest, and by all means call me, use me as a resource to say, this is where I'm at, this is the plan I know I want to go into, who on Long Island is offering it for the most affordable. And I can tell you, because I'm an agent with all of them, what plan and who's offering it at the most affordable rate. To be eligible for a supplement plan, generally you must be enrolled in A and B. So no matter what you pick, you have to be enrolled in B. You have to pay that $104.90. And you have to reside in the state which you're applying for coverage. You have to be 65. You can be under 65 with certain disabilities in some states. And it's for people who have end-stage renal disease. So some fast facts about the supplement plans is it helps with your out-of-pocket costs, not paid by Medicare. And the premiums vary based on the plan. So everyone could put their own premium number on it, but the plans are identical. Enrollment, you're guaranteed the right to enroll during the open enrollment period, which is when you first turn 65. It begins the first day of the month that you're enrolled in Medicare Part B, and in most states it lasts for 6 months. The coverage cannot be denied It can be denied if you enroll late. But this is the annual enrollment period, which allows everybody who's in an HMO or a PPO to say, I'm happy with the plan, I'm staying here, or I'm dissatisfied and I want original Medicare. You have until December 7th to decide if you want to go back into original Medicare and pick up a supplement. Coverage, it goes with you anywhere in the United States. So if you purchase it in New York and you're moving to Florida, or you travel and you're a snowbird, no matter where you are, you wake up and you have a rash, you could walk into a dermatology office. There's no referral needed, there's no book, is he in the network, is he not in the network? Any doctor, any hospital affiliated with Medicare, you could walk into. It's guaranteed, yes.
That's the key though, if the doctor or the hospital accepts Medicare, correct?
If the doctor or hospital does not accept Medicare, it doesn't matter which option you picked, you cannot see that doctor. So when you participate with Medicare and you do not have insurance from an employer, if that doctor opts out of original Medicare, and I personally have never seen it in Nassau or Suffolk County, I have in Manhattan, and the doctor's telling you, I will see you, but it's cash only. I'm taking no insurance. And he's got, you know, a wealthy clientele or a name for himself, prestigious, that he just could turn down, you know, but I have never seen it in Nassau or Suffolk County.
I'm curious. We have something here called the hospitalist program. In the local hospital, we get bills out of the wazoo. And that's the doctors. When you're in the hospital, they're always sending you an extra bill because Medicare doesn't cover it. If you're treated in the emergency room.
And you're on original Medicare?
Yes.
And do you have a supplement or an
Yes.
Advantage plan?
Oh, yeah.
Which one, a supplement or?
AARP.
So
Plan
the-
F. And you still get a bill from the hospitalist program.
From hospital, from the hospital?
Hospitalist, whatever they call it.
Hospitalist.
It's,
I've never
it's the
heard of that.
doctors.
Talk to me or show me after. That's a private
it's in
thing.
Southampton Hospital. We all go to that.
Yeah, I have a few clients quite a few clients that have the F plan, and I've never heard of extra charges outside of
Hospitalists.
hospitalists.
Some doctors that you know, what the government pays for, they charge you the extra.
But Plan F covers the excess doctor charges.
Uh-huh.
It's part of the contract. All right, well, I've never
don't
seen it.
find
I
that.
actually have never seen that. Yes.
My doctor happens to be a hospitalist, and he explained to me that he has to provide 1 day a month service to the hospital, the local hospital in New York. I didn't know how he charges or who pays him, but all the doctors, not all, but many of the doctors are required to sign up as sort of a volunteer thing.
And then you get the bill and Medicare doesn't pay it?
Well, I haven't talked to him about billing yet, but I will after this conversation.
Yeah, I've never, honestly, never seen it, so I am curious to see what bill you
The
have.
reason for it, he tells me, is so there's always a doctor on the floor that will see you if your doctor's not available. That was the way it put it.
Yeah, I think that's brilliant. I think that's great that you have that someone cares enough to make sure that you always have a specialist in the hospital. So that's something privately, if you don't mind, I'd like to see what that
It's
is.
just it's a nuisance in Southampton Hospital. Probably one of the worst run places in the United States.
Oh, don't say that.
All right, I'm going to go back to my presentation because I don't know the hospital, but coverage. So it goes with you anywhere in the United States, which allows you not to have to go to Southampton Hospital. You can go to any hospital you choose.
I know, but it's the
And
closest
it's guaranteed to continue as long as you pay your premium. So the wonderful thing about original Medicare and a supplement plan is once you purchase into a plan and you have Plan F, even if they say we are no longer offering Plan F, it's been discontinued, you're grandfathered in. So you could never be canceled as long as you pay your monthly premium. The plan will continue for the rest of your life. You'll be grandfathered in, so other people won't be able to join, but you'll be involved in it already. Do you have a question?
Yes, is Plan A, or Plan F with the high deductible, is that available in Massachusetts?
Yes, it is.
It is.
And call, if you're interested, talk to me after.
And premiums go up on those things like Plan F?
The premiums, yes, the premiums go up on everything, on both sides, definitely. I have seen a large jump with the Advantage plans and the supplement plans, depending on the company, you know, they put different prices on it. What I tell my clients is if it went up with one company, if you're happy with the plan and the other company it didn't go up, then go into the other company. You know, you could, as you want to make sure that you find a plan that you like and who's offering it for the most affordable. So you're guaranteed renewal as long as you pay your premium and you haven't made any material misrepresentations. So to bring it all together, it's this chart that I absolutely love, because you have original Medicare and you have your A and your B, and you really, it comes down to you have two options. And the options are what are important, like there's not one plan in here. People go, I just want to know what's the best plan. There's so many different things. If you tell me, I met someone today and her priority was the gym membership. She says, I don't go to the doctor, I'm healthy. The priority to me is who's offering the gym membership in my Advantage plan. So it could be that you want that. It could be my income is low. Who's offering the premium, the cheapest? It could be I'm very sick and I want 100% coverage. I don't want to see a bill and I'm willing to pay a monthly premium. So there's no one plan here that's just perfect for all of you. It really goes by your budget, your needs, your health care. But you see, it's as simple as two plans. Option one is keeping original Medicare. That, I say, is your golden ticket to any doctor and any hospital in the United States. You pick what specialist you want to see. You pick who your surgeon's going to be, what hospital you're going to have care in. And then your other option is your HMO and your PPO. It's an Advantage plan. And the wonderful thing about that is they do put in vision. They give you some money towards eyeglasses. Some of them put in a gym membership or hearing aids. So there are advantages to the Advantage plan and the simplicity of one card. So those are your two options. As I said, I'm an agent with both sides of it, and always if you want information, you could always contact me. Request my business card after my presentation and I can assist you. So when can I enroll? Well, Medicare Part A and Part B, original Medicare, you enroll the first 3 months before you turn 65, the month of your birthday, and then 3 months after. Enrollment in A is automatic. So especially if you're receiving Social Security benefits, you'll get it automatically, and when you turn 65, you'll get it automatically. What if I'm late? For Part A, there's usually no penalties because it's an automatic thing. For Part B, because you need to elect that you want Part B if you have no employer coverage, and your premiums will be higher after the initial period, so after that 7-month window, if you did not elect to be in Part B and you did not have employer coverage. So this is showing you what the penalty is. 3 years at 10%, she's going to pay 30% of the $104.90 because she waited 3 years before she enrolled in Medicare Part B. So everyone's paying $104.90 and she's going to pay $136.37. And her penalty of 30% of the number of that year will be the rest of her life. So when can I enroll in C and D? You can enroll in Part C, the Advantage plan, and Part D, the drug plan, 3 months before your 65th birthday, the month of your birthday, and 3 months after. And what if you're late? Then you need to wait for the open enrollment period. But the open enrollment period is now also, so even if you're already part of it, this is when you can make change, October 15th to December 7th. What if I work past 65? So if you work past 65, you may enroll in Medicare Part A and Part B. I say to people that are employed, talk to your human resource department. Some of them require that you be part of Part B when you turn 65, and some companies say, we'll cover your Part B when you turn 65. So you enroll in it and they'll pay you for it, but you want to make sure you don't get a penalty, and only your company can tell you if you should have B or not. So we always recommend you talking to your benefits administrator. Keep records of your health insurance coverage. That's very important. And if you're retiring after 65, when you retire, you're eligible for a special enrollment period. So people go, oh my goodness, I'm 70, I didn't get my Part A, my Part B, am I going to get all these penalties? Not if you had employer coverage. If you had employer coverage, you had credible coverage for those 5 years. When you're about to retire, you then let Medicare know, I'm going to retire, this is my 6-month window when I'm thinking about retiring, and I want Part A and Part B to be effective for January 1st because I'm going to retire in January. And you could let Medicare know 3 months before you're going to retire, and then you'll get your card, and it gives you 3 months to educate yourself on what you want to choose, and there will be no penalty because you had employer coverage. So you will actually be eligible for a special enrollment period. So it doesn't have to be January 1st. You could say, I'm going to stay and I'm going to work until March or April, May. When you decide you want to leave your coverage, that's when Medicare will begin without any penalties. It allows you 63 days after your employer coverage ends to enroll into Medicare in a plan without a penalty. So I always tell everyone, as soon as you get that retirement date and you know your employer is not going to cover you for your medical benefits, let Medicare know right away. Because then it gives you 63 days to educate yourself on, do I want option 1 or do I want option 2? A Medicare supplement plan insurance, you can enroll the month you turn 65 and then 5 months after. And if you're late, you may be charged a higher premium, but not in New York. That doesn't pertain to New York. You'll never get charged a higher premium due to existing health problems in New York. Everyone's premium is the same. So what are my next steps? Review enrollment periods. We're right now in the annual enrollment period where you can go back into original Medicare. Research, research, research. Use all of your resources because it's important to contact Medicare. Contact me. The back of the Medicare book has SHIP, S-H-I-P number, and they offer you a wealth of information. And the last pages are all the resources of this phone numbers in this little brochure. Ask questions. I tell everybody, ask everybody around you. What coverage do you have? Are you happy with it? What doctors, talk to each other and find out to get your answers. Find financial help. If you feel your income is low, by all means, apply for services. Because even if you're right on the cusp and you're not sure, you apply for the Medicare savings programs, and the worst thing is they deny you if you're not sure. Enroll, make sure that you enroll and you get all your paperwork in time. And every year, even if you absolutely loved your plan, you have to review it, because those Advantage plans really change, and Medicare co-payments and deductibles, the numbers change on that. So once I'm covered by Medicare, how could I save money? I suggest that you look at the back of the book for the resources of this booklet, the numbers to contact Social Security and Medicare. Let them know if you think your income is low, or if you're only on a Social Security check and you're not on a pension. You get a lot of services if your Social Security check is low. And you want to look for and educate yourself on the Medicare savings programs. EPIC is a wonderful, wonderful pharmaceutical assistance program. And what should I think about as I compare my options? So as I said, there's no one plan that fits everybody. What's your health? What's your finances? What about my location? Do I want a plan that's only going to cover Suffolk County when I spend 6 months in Florida? You might want to have a supplement plan that you could travel with. What my coverage needs. You kind of need to know what is your priority when you're looking for a plan, and then I can assist you. I'd be more than happy to, if you want to call me, to put you towards the right direction. If it's a financial status that it's a financial burden, or if it's a health status of where you should be for your health care coverage. And the booklet that I'm giving you is more information. Of course, The Medicare book has all different numbers on the back of your Medicare book, and Social Security. And again, on the back of your Medicare book, everyone gets mailed Medicare and You, is the SHIP. It's State Health Insurance Assistance Program, and it's your local SHIP phone number, and they really are a wealth of knowledge and resources. So, do I have any questions? Yes.
Where do you enroll? How do you go to computer you enroll into Medicare, or automatically comes to you?
You can on the computer. When you turn 65, and you'll get the Part A, you'll get the Medicare Part A card. If you haven't,
Automatically to your house?
Yeah, it's automatically. And it'll give you the option to enroll in B or to hold off on it. And if you sign that you want it, then you'll get the Part B. If you have employer coverage and you're not retiring, you might not need the Part B. So the Part A is automatic. I tell people, just in case, if it's 2 months before you turn 65, or you're down to the month before you turn 65, if you still haven't received anything from Medicare, call Social Security. Make the phone call and say, I'm turning 65, will I be getting my Medicare Part A? If you are covered under your employer coverage, you'll get the A, but you don't need the B. But to double check with your human resource department. And if you're getting Social Security checks, you'll automatically get your Part A and Part B card at 65 too.
So 3 months before, or?
You'll get it probably anywhere from 3 months before till
So A and B.
A and B, if you're collecting Social Security at
If you have
65.
disability.
Disability, after 24 months of collecting disability, you'll automatically be enrolled in Part A and Part B.
And that comes to you.
Automatically, the card will come after the 24th month of, it comes the 23rd to the 24th month of disability. Okay, any other questions? Yes.
You said, go ahead.
The numbers again, the new numbers, is it 75?
I have
or
it. So,
75
it's right in front of me.
what you said?
Yeah, so for Epic, this year, if you're single and you make under 75,000, you could apply for Epic. And if you are married and you file joint, if you make under 100,000. And the Epic phone number to request an application and to read more about it is 1-800-332-3742. And that's the Epic hotline.
Is that just for drugs?
Yes, you have to be 65 or older, and it's to assist you in your drug coverage. Correct.
Do you apply for this in tandem with Part D, or do you wait till you might need it and can enroll later?
It depends on where your income is on the chart, because certain parts of it you actually have to pay for Epic, and other parts of it, depending on your income, it's a deductible. It goes by how much you spent at the drugstore, and then Epic kicks in. So if you're on all generic drugs and they're asking you to pay for it, for Epic, I tell my clients, don't enroll in Epic, because it's going to cost you $500 this year to be part of Epic, and you're only on $150 worth of drugs.
You have
But-
to enroll during the enrollment.
No, you can enroll at any time, Epic. There's no open enrollment. No, Epic, it depends on your income.
Yes, I understand.
Yep, so there's a different rate from 0 to 100,000. They'll mail you all the information. Epic will mail you the information. Yes.
Question. On the Epic, do they want to see what prescription drugs you're on?
No, Epic it has 2 questions. How much money are you making from Social Security?
Right.
And then the next question is, how much money are you making from wages, IRA, interest, and then sign. So it's your basic information. How much money are you making? They don't want to know any drugs that you're on. You sign it and send the form into Epic. They mail you the application along with the return envelope.
say that if drugs are not an issue really, then it's not worth it?
Yeah. If you're not on expensive drugs, but you are single and you make under 23,000, Epic will pay for your Part D premium. So even though you're not on a lot of drugs, if you're in a plan that's $22 a month and your income is below 23,000, Epic will pay that $22 a month for you. So look into it, get the application, read it over, and if you have questions when you're at that point, call me or call Epic directly, and they'll assist you in what your fees will be.
Now, does somebody assign you a prescription? Are you wound up with Express Script? I have no idea what that is.
I don't know who would have put you on that.
Pharmacy.
Usually it's an application you have to sign. I'm not sure. Yeah. So, yes, sir.
I turned 65 a couple months ago and I haven't gotten fired or anything.
Are you still covered under employer coverage?
I am.
Okay. So, but you didn't get your Part A
No.
even. So you might want to contact Social Security. You don't need it because you actually don't need to hold your card because your Part A and your Part B right now is covered under your employer. So somehow they see that. So it didn't come automatic. When you decide you want to retire, if your company tells you you're no longer going to be getting coverage, then you want to let Social Security know that you're losing your coverage, and then you need the A and B. If it's coverage for life, you might not ever need that.
So I won't be penalized?
Never a penalty,
for
no,
not-
never a penalty. So everyone's got their own personal questions. By all means, ask me for my business card. I'm not handing out my information because this was an educational presentation and my time is up. So I do need to be at another location. So ask me for my information. I'll be more than happy to assist you. But thank you very much, everybody.